Ready? So hi everyone, my name is Kezia Makena. I'm a public health practitioner based here in Nairobi, Kenya. I work as a project officer in a non-governmental organization based here in Nairobi. And for the few years that I've worked for the organization, we've implemented health projects around, and one of our beneficiary area is Korogosho area.
Okay, I'm Janet Awino, CHP from Korokocho. Korokocho hii yetu imekuwa na so many problems. First of all, the biggest challenge that we are having in this community is that we have got young teenagers pregnancy, and this young teenager pregnancy, they don't have anything to do. Another thing is that most women are idle. They don't have anything that they can bring as a daily income. So you'll find some mamas, they do take their daughters for prostitution so that they can get something to eat. And another thing is that you may find some children, they go out of school dropouts because many parents cannot afford to get school fees. And also you'll find some people, most women in our community, they are single mothers and also widows. The high rate of community people here in Korokocho, they are single mothers. So you'll find that they cannot manage to do anything, or they cannot manage to pay school fees, they cannot manage to pay rent, they cannot even manage to bring something on the table that they can eat. So it is very hard in our community for those mamas to maintain their daily bread. And you'll find them, most of them, they normally go to casual working, they do clothes washing, and yet you'll see that sometimes the rain is there. How these mamas they do to survive is very hard.
Ni wengi tunahangaika, unaweza tafuta vibarua, unapata hakuna, na mahitaji yetu unapata iko juu, lakini kihali ya fedha hatujawezeshwa. Maisha ni ngumu. Vyakula iko ile unaweza pata hiyo pesa ununue chakula ni ngumu. Kazi unatafuta hakuna. Unaweza tembea long distance lakini ukifika kazi hakuna, ukirudi kazi hakuna. Unapata sasa, na wengi tuko na watoto, na wengi tuko single mother. Sasa tunashindwa vile tunaweza saidika. Kwa hivyo tunaomba tu mtuangalie tu vile tunaweza faidika tu, at least tungoja watoto. Kuna wengine tena wanatuhitaji kando na watoto. Unaweza kuwa unaishi na ndugu yako, aidha unaweza ishi na wazazi wako, na wewe ndio aidha wewe ndio unawasimamia. Unapata ni ngumu vile unaweza saidika. Kama mimi hapa nyuma nilikuwa na mimba, yes. Tangu nilee mpaka ifike wakati wa kuzaa, kuna changamoto nilipitia. Si kugonjeka, inabidi unahitaji dawa, unahitaji hospitali. Unaona saa zingine unaambiwa ulazwe, na hiyo kulazwa unapata kuna wengi pia wanakuhitaji na uwezi lazwa. Alafu unafika mahali wakati wa kuzaa unashindwa nitafanya nini na sina pesa. Saa zingine umetumwa skani na una pesa. Sasa unafika mahali unaona hospitali ziko na nini? Wewe mwenyewe changamoto ni ngumu. Unafika mahali unaona wakati umefika wa kuzaa. Sasa hapo unaona mahitaji yenye natakana ni ngumu.
Come stai? Bene, bene tutti.
My name is Helen. I'm a social worker by profession. I'm also a counselor. I started working in the community in Nairobi, 2002. There are things that probably as an individual becomes very difficult to make changes even at the health facility, because when you work for income on basis, you'll realize that people have diverse needs. But when you go to visit, you give them hope. And sometimes you even encourage them to come to the health facility. Sometimes even the services that are offered there, maybe there are also gaps in the health facility, and maybe they cannot access those services at the local health facility. That means that they have to go to a higher level of services in order to get those services. But when they reach there, they have to pay for those services, which is quite a challenge, like where we are now, Korogocho, and it's a slum. So people live from hand to mouth. So sometimes if they are referred from this health facility to the next level and they have to pay, you'll find that some people even opt to die at home or seek for other interventions like maybe spiritual or the local intervention like local medical doctors.
So for many people in this neighborhood, healthcare access is still a very huge problem. And this is because of limited access of supplies and medication at the facility level, stigma and discrimination that comes with access to certain health services like HIV and AIDS, and financial barriers. Financial barrier is one of the biggest challenges. Most of the families struggle with the high cost of treatments and getting medication. So you find even if there's medication at the facility level, it's quite expensive for them to afford.
Yeah. Okay, my name is Vincent Ansongo. I'm the facility in charge here at Ngomongo Level 2. Ngomongo Level 2 is located in an informal settlement, and it serves like a large population. To quote the number, that's its catchment population is about 23,017, and it serves people who have constraint in terms of financial constraint. So especially you find that they are not able to finance medications, to finance different diagnostic tests that we send them to do. Of course, it's an issue, and it's a big issue because especially we have a catchment population of maternal, those women who are pregnant women. We have a catchment population of 782. Among that population, we have women who are low income and those who are suffering from poverty. It's been an issue, especially in lack of supplements, including IFAS. It's been an issue in areas of supportive diagnosis, like sending a mom for an ultrasound to make a diagnosis or to confirm the pregnancy. So you find that, especially that population of pregnant women, they are not able to support themselves in terms of medication that are not available at the facility, and they are not able to support the investigations that they are sent to do outside the facility. I'm just pleading with our viewers to support Ngomongo Level 2, which is in an informal settlement, to support our moms to have dignity antenatal care, and also in future maybe we shall have a maternity wing so that they can equally have a dignity maternal child care. Yeah.